Mr. Beyer.
Mr. Chairman, thank you very much. And Mr. Secretary, good to have you here. I want to just add my voice to the concern about the new TANF rule, specifically about high school dropout prevention programs. Some of the most important ones around the country, Jobs for America's Graduates and others, rely on TANF funds to pay for it. And the argument, of course, is better to people that don't need to go on TANF in the first place. And I hope that you and your folks will pay attention to that. What we'd like to do is ultimately reduce the overall TANF burden. And it's the old pay me now or pay me later piece. I also want to thank you and applaud your dedication to suicide prevention and mental health. You know, it's really important that we adequately fund the 988 number, the CDC suicide prevention effort. I believe there were 507,000 calls alone in the month of January. It's making an enormous difference. And I also want to applaud you for your work on long COVID. You know, it's still we've done a lot. Last week we had Long COVID Awareness Day, but we still don't really understand post-illness acquired conditions, and now is the time to ramp up for the lessons learned. You know, President Biden is leading on the AI revolution, and I know you've testified its consideration in your budget. You've been using artificial intelligence in healthcare, the FDA specifically, for years, but can you talk about what gaps you see in your existing regulatory authorities and funding when it comes to supporting AI innovation in healthcare?
Congressman, great question, and thank you for the work that you've done on this subject. We don't have enough authority to really go in and see behind the curtain of what's going on with a lot of these entities that are using AI. We'd like to make sure, for example, that the algorithms that they're using won't end up discriminating against people because the data they're using to input into these algorithms don't take into account the needs of particular communities. We'd also like to make sure we have a better sense of how they're going to deploy some of this AI technology, because it could be done in a way that, once again, it leaves out certain communities if they don't happen to fit the criteria or the perspective of that particular algorithm. AI can be a tremendous asset. It can help produce efficiencies, accelerate access. At the same time, if we're not careful, it will do it only for some but not all Americans. And so our interest is being able to look behind the curtain to make sure that the platforms that are being used have equity in them from the very beginning.
Yeah, very good. Thank you very much. There's a lot we can also learn from the electronic health records conversation with respect to AI. And one of the ideas has been an assurance lab, which I know the FDA Device Center Chief's been considering. Can you talk about if this is something HHS is seriously pursuing, the whole notion of assurance labs?
I'm going to tell you I'm not as deep on that as I should be, and what I could do is get back to you and make sure the team responds well from HHS.
I also want to say, on the negative side, we're still disappointed at the continued underfunding of AHRQ ARC. It's a really important part of your HHS piece to get the quality right to begin with.
I got to give you a hug, Congressman, for saying that, because you're absolutely right. They do some tremendous work.
Thank you. And finally, on CMS data concerns, the research community has talked to us about CMS has announced changes to its research identifiable file data and the discontinued delivery of physical data extracts. We're hearing that they could be incredibly damaging to public health system research and health research at large. The Virtual Research Data Center, all caps, has significant coding limitations, it's slow, has regular system errors, interoperability limitations, among other things. And apparently there's significant new fees to access that can run tens of thousands of dollars per researcher, per year, per project, with no option even for having screen sharing among researchers in the same project. Can you talk about how HHS and you can address the access and affordability? What makes VRDC usable in the first place?
Congressman, you've touched on something that I think will become a very important subject to resolve, and that is that data is so valuable, and for researchers, it's gold. And we want to make sure that researchers have that information that they need so they can continue to come up with innovations and therapies that will keep people alive. At the same time that we know, as we saw with Change Healthcare, that there are bad actors who are constantly trying to get access to that same data and use it for the wrong reasons. We have to make sure that everyone who accesses data, and we provide a lot of data, that it's not misused. And so we're just doing what everyone is now having to do, is moving toward platforms that provide more security, because you don't want your personal data I don't want my personal data to get to go into the wrong hands. If it's a researcher doing the right thing with it, great. But we don't know, and we have to live in this new world. That's why we're migrating to something that provides more protection. But we'll continue to take comment because we've heard these concerns, and we want to make sure at no point do we stifle research.
Thank you very much, Mr. Secretary. I yield back.